Hi, this is Reed Stone with Northern Hills Dental. Just want to talk to you about the options you have for replacing an entire arch. So there's really 5 options that we traditionally can offer patients. I'll go through all 5 and then we'll kind of come back full circle and pros and cons of each. Best way to think about it is if you it's kind of gory, but if you say you were to just have your arm cut off or your hand cut off just right at the wrist here. I'll kind of give some comparisons to these, and sometimes it's a little easier to compare that than going into the dental details with some of this other stuff. So anyways, so the first option is really nothing. This is people's gums aren't blue like this, but basically this is just all the teeth come out. You use a blender, straw, whatever, soft food, and people do it. I don't have very many patients in my practice that elect this option, but you can get it done. So picture that, kind of like you have your hand cut off. It's a nub, basically. I mean, people for hundreds of years have been fine with that. So second option is basically just kind of the hook hand, I guess is what I refer to it as, is basically just a conventional denture like your grandparents had. Basically teeth come out, and this goes in and uses Fixodent, different adhesives to hold it back up in there, but that's an option as well. So kind of the step up from that, I refer to this kind of as the rubber hand option. So it's going to look pretty natural. You're not going to have to use any dental adhesives or that type of thing. And what it does is it actually holds in there with, in this case, 4 dental implants that are just surgically placed, and you can actually snap this into place, where this one relies on dental adhesives and that type of thing. This one you can actually just snap into place and it's not going to come out. So you can eat corn on the cob. Also, you can cut the palate of the denture out so you can taste foods better, speak better, a little more natural. So that's our rubber hand option. Kind of stepping up from that, this is basically just a 1-unit bridge. Basically, this only comes out once a year. Traditionally, there's 4 to 6 implants that get placed there, and this is an option for something that just doesn't come out. We take this out at our office once a year to clean around the implants and things like that, but it actually gets screwed into place. And there's a company called Clear Choice that if you watch cable television, advertises these a lot, and that's what this option is. And this is called a fixed hybrid, or a one-piece ceramic bridge, where these are all acrylic or plastic. This is actually a ceramic material, so it looks real lifelike and natural. So this is what I would consider more like a natural hand. I mean, fully functioning. A lot of patients don't even notice or have any disability with not being able to eat the foods that they enjoy, and fully function and not really realize they have anything unnatural there. So then the 5th option is basically the same as this, but we'll traditionally place 8 dental implants, and we do it in pieces. So we do like 4 of these 3-unit bridges here. So really, between these last 2 options, besides a huge difference in cost when you jump up to this option, these 2 are really the same as far as functionality. The only reason you would go with this option over this option is if you weren't ready to do it all at once and you wanted to kind of do it in phases over several years. So that's really the only reason to go with something like that. So again, to kind of come full circle, we have basically just the nub, which is just nothing, and a nice blender or soft food. Second option is just a conventional denture, which is kind of your hook hand, does the job, but not too aesthetic and kind of utilitarian. The next option is the rubber hand, which is just 4 dental implants and teeth come in and out, snap in and out. And this option, this fixed hybrid, or the Clear Choice type option, or the one-piece bridge, that's kind of your fully functional hand. You regained full functionality. And then the 4 individual bridges, same thing, just over time and higher cost. So the subsequent videos I'll kind of dive into each of these options with a little more detail, but that's the generic overview of all those. So again, this is just replacing a full arch and the different options you have. Thanks for watching.